How often day and night, character, PQRST, position, quality, radiating, setting, trigger, if vomiting or diarrhea, color, horror, consistency, amount, timing, feeding or meals, position or meals, is it increase or decrease, is he drowsy, what about his cry, does he cry, floppy, did you notice his sucking is weaker, do you have fever, any skin rash, ear pulling, discharge, foul smelly urine, abdominal distension or diarrhea, cough or wheeze, irregular, hospitalization, surgeries, infection, illness, medication, allergies, travel, hospitalization, surgery, medication, illness, allergies, travel, family history of similar disease, birth, immunization, nutrition, development, environment, 6 to 14 school performance, 14 to 18 home, education, activity, diet, suicide, sexual activity, SAD, smoking, alcohol, drug, pregnancy. Was your planned? Were you having regular follow-up visits? How about ultrasound? Was it normal during your pregnancy? Did you have illness? How about any fever or skin rash? Have you ever been in contact with the sick kids? Kids with a skin rash or fever, have you ever been in contact with the pets? Did you take medications, even OTC, over the counter? Did you smoke, drink alcohol? Have you ever tried recreational drugs? What about before pregnancy? Medications, sick contact, planned follow-up contacts, medications, hepatitis B, HIV, any other diseases. We need test that is taken a swab from 36 week called GBS. Did you have it? What is your blood group? What is your blood group type? Was your baby full term or not? Was it a vaginal delivery or a C-section? C-section, what were the complications, abnormalities? Was the difficult labor, prolonged labor, any sudden gush of the blood or sudden gush of water? How many hours? Did you need any help to make it easier or vacuum? Prolonged, difficult, many hours, gush, cry immediately, a car, school, any special conditions, any special attention, leave the hospital, any bruises or swelling or any other baby's body. Were you told that your baby had any other special features after delivery? Did you have any fever, discharge? Did you take any medications? Are the babies shot up to date? Yes. When was the last shot? Any reason for that? Any of religions prohibit? That is fine. Vaccine, correct. Vaccines are safe. We are busy. What is a baby's weight? What was the weight when he's born? At birth, it is highest to high weight, third percentile underweight. 4 times by the 2 years, 3 times by the 1 year, 2 times by the 5 year, more than 2 year. Should be age into 2 plus 8. 14 kg. For a low birth weight, catch up later. Iron, vitamin D supplementations, even when it since birth. Any reason that you choose formula or the breastfeeding? Which formula? Any recent change in formula or any case of chronic diarrhea? first? How many times do you change? Draw circles, sit alone, crawling, running, what matter how you feel, with only reverse relationship with you, with baby and with your baby. How is the relationship between you? Do you support financially? How do you support financially? Do you live in a home or apartment? Is it an old building? Any other children in the house? Do you or anybody in the house smoke, drink, use recreational drug? Is anyone of your family seeing a psychiatrist? Are you dating? Are you in a relationship? Are you sexually active? When did you start? Are you dating? Are you in a relationship? Are you sexually active? When did you start? Do you practice safe sex? When was the last time? How many partners do you have? Are you dating? Are you in a relationship? Are you sexually active? How many relationships? How many partners do you have? Did you start? When was the last time do you practice safe sex? Now I would like to ask you some personal questions. It is important to ask you if it is a confidential. Important to ask. Do you smoke, drink alcohol, or have any recreation? Sometimes people at your age might start smoking. Do you know any of your friends doing this? How about you? Have you tried that? What is the last time? When was the last time? Did you share needles? Join us. The newborn 5 kg old with the jaundice since day 2. Breast milk, jaundice, breastfeeding jaundice. Or late. Leave the second day or late. Who noticed it? You or someone else? When? When did you notice it? How about his eyes? How about his feet? Is it spreading? Increase or decrease? Is it spreading? Increase or decrease? What about his eyes? What did you notice it? Who noticed it? When? Notice you or someone else? When? How did you notice? How are his eyes? How did his feet? What about his feet? Is it spreading? Urinary tract and stools, which pale tract. The stools are very drowsy, sloppy. birth. Is the pregnancy planned? Is the pregnancy planned? Any baby full term vagina, that's predisposed pregnancy, birth planned, follow visit, contact medication, screened blood group, contact medication screened blood group, contact medication screened blood group. Was your pregnancy planned? Were you open the follow-up contact, sick contact, or in the animal contact? Medication screened blood group, medication screened blood group, pregnancy planned, follow-up, medication screened blood group, medication screened blood group, contact. P, follow visit, PFCMS group. Full term vagina, if cesarean. Was there any complication? Vagina, prolonged labor, any gush of water, how many hours? Did they use any aiding to make it easier? Immediate cry, any bruises? When was the baby delivered? Discharge, after delivery, do you have fever, discharge? Did you take any medications? How many times do you feed the baby? How do you feed him? Breast milk or formula? How many times do you feed him? Do you use one breast or both of them? How long each? Because commodity में है जो डाल दिया था shoot. How many times do you feed him? Do you use one breast or both of them? How long each? After feeding him, do you feel your breast engorged? How many times do you feed him? Do you use one breast or both of them? How long? After feeding, do you feel your breast engorged? How do you feel him? No, how do you feed him? Breast milk or formula? Any reasons to choose formula feeding? What type of formula? Do you know how to prepare it? What type of formula do you know how to prepare it? What type of formula do you know how to prepare it? What type of formula do you know how to prepare it? What type of formula do you know how to prepare it? What type of formula do you know how to prepare it? What type of formula do you know how to prepare it? What type of formula do you know how to prepare? Any time, any reason to choose formula feeding? Any reason to choose formula feeding? Any reason to choose formula feeding? How many times do you feed him? Okay. How do you feed him? Breast milk or formula? How many times do you feed him? Do you use one breast or both of them? How long after feeding him do you feel your breast engorged? Any reason to choose formula feeding? What type of formula do you know how to prepare it? How do you feed him? Breast milk or formula? How do you feed him? Breast milk or formula? Do you feed him breast milk or formula? Do you feed him breast milk or formula? How do you feed him? Breast milk or formula? How do you feed him? Breast milk or formula? How do you feed him? Breast milk or formula? How many times do you feed him? Do you use one breast or both? After feeding, do you feel your breast engorged? How do you feed him? Breast milk or formula? Do you feed him? Breast milk or formula? How many times do you feed him? Do you use one breast or both of them? How long do you? How many times do you feed him? How many times do you feed him? Do you breast or no? How long do you feed him? Do you use one breast or both? How long each? After feeding him, do you feel your breasting guards? Any reason to choose formula feeding? What type of formula? Do you know how to prepare it? Any of the children, did any of them develop jaundice after birth? Before any of the children, did any of the develop jaundice? Past history, medical history, नहीं. Jaundice. Does anybody have history blood disease, cystic fibrosis? The first day of the life was made more than 85. We have nothing to do. Hydration and feeding. Treat the underlying infection. Food therapy. The bilirubin is more than 300 and only for unconjugated hyperbilirubin. If it is unconjugated hyperbilirubin and more than 300 mmol per liter is contraindicated. Is directed hyperbilirubinemia. Directed hyperbilirubinemia. Contraindicated in directed hyperbilirubinemia. Exchange transfusion if both bilirubin is more than 400. If total bilirubin is more than 400, exchange transfusion if the bilirubin is more than 300, unconjugated hyperbilirubinemia. Phototherapy. Proper hydration and feeding. Treat underlying infection. If total bilirubin is more than 300, only for the unconjugated hyperbilirubinemia. It is contraindicated in direct hyperbilirubinemia. It is total bilirubin more than 400. There is a concern. Will he develop mental retardation? This is a reasonable concern. I am glad you came here today to figure out. This is a reasonable concern. I'm glad you came here today to figure out what made you think about that. This is a reasonable concern. This is a reasonable concern. I'm glad you came here today to figure out what made you think that. In order to be able to answer this, I first need to ask you some questions. In order to be able to answer this, I first need to ask you some questions. Examine him, and we may need to do some blood tests. In order to answer this question, I first need to ask you some question, examine him, and then we need to do some blood test. This is a reasonable concern. I'm glad you are here today to figure out what made you think that. In order to be able to answer this, I first need to ask you some question. In order to be able to answer this, so you need to do some tests. We need to ask you some questions and examine him. However, I would like to inform you that jaundice in newborn is a common condition. It is usually physiological jaundice that does not lead to mental aid, and it is usually physiological jaundice. Jaundice is really common in the first few days of the newborn. This is a reasonable concern. I'm glad you are here today to figure out. I'm glad you came here today to figure out. This is a reasonable concern. I'm glad you are here today to figure out. What made you think this. In order to be able to answer this, I first need to do some blood test, examine it and do some blood test and ask you some questions. But I would like to inform you that Jaundice is common in the first few days of a newborn. It is usually physiological jaundice that does not cause mental retardation. Complication of RH incompatibility. It causes curvatures, brain damage, sears, fetal hydrops, generalized edema, and hypoglycemia. Curvatures, fetus, hypoglycemia. Curvatures, hydrops, fatalis, and hypoglycemia. Curvatures, fetal hydrops, fatalis, and hypoglycemia. Curvatures, 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 hypoglycemia. Curvatures, hydrop, fatalis, and hypoglycemia. Curvatures, hydrop, fatalis, and hypoglycemia. Curvatures, hydrops, fatalis, and hypoglycemia. IUG are a newborn 3-hour-old with IUG comes from the mother. Good morning, I understand you just gave birth to baby. My colleagues are taking care of your baby, and I would like to ask you some questions regarding your child health. But first, tell me, how do you feel right now? Have you seen the baby? Did you pick a name? How do you feel? Have you seen the baby? Did you pick a name? I understand that you are here. No, I understand that you gave birth to a baby. My colleagues are taking care of that baby, but I would like to ask you some questions regarding your child health. But first, tell me, how do you feel? Did you see the baby? Did you pick up a name for the baby? Your baby just have been diagnosed with a condition called intrauterine growth reduction, retardation, or low birth weight. For that reason, I would like to ask you some questions about your pregnancy. Good morning, I understand that you are here today. Good morning, but I understand. I understand that you just gave birth to a baby. You just gave birth to a baby, and my colleagues are taking care of the baby. And I would like to ask you a few questions regarding that. But first, I would like to ask you, how do you feel? Have you seen the baby? Did you pick up a name? Your baby has been diagnosed with a condition called intrauterine growth retardation or the low birth weight. For that reason, I would like to ask some questions about your pregnancy. Fine. Birth, immunization, there is no immunization, there is no nutrition, there is no development, there is no environmental factors. For now, we just have to do birth. For birth, we need to ask for the pregnancy and delivery. Okay? Obstetrical history, GD4. Were you pregnant before? How many times? Any abortions, miscarriages? Were you pregnant before? How many times? Were you pregnant before? How many times? Any abortions, miscarriages? Were you pregnant before? Any miscarriages? Were you pregnant before? How many times? Any abortions or miscarriages? Mother past medical history. Any history of chemotherapy or exposure to radiations, any family history with a congenital anomalies. Good morning, I understand that you gave birth to a baby, and I would like to ask you a few questions regarding that. But first, I will ask you, my colleagues are taking care of that baby. I would like to ask you a few questions regarding your child health. But first, tell me, did you see the baby? How do you feel about right now? Did you pick a name? Your baby has been diagnosed with a condition called intrauterine growth restriction or the low birth weight. For that reason, I would like to ask some questions about your pregnancy. Birth, obstetrical history, GD4, gestational, termination, pregnancy. Were you pregnant before? Were you pregnant before? How many times? Any abortion or miscarriages? Were you pregnant before? How many times? Any abortion or miscarriages? Were you pregnant before? How many times? Any abortion or miscarriages? Were you pregnant before? How many times? Any abortion or miscarriages? Were you pregnant before? How many times? Any miscarriages or abortion? Were you pregnant before? How many times? Any abortions and miscarriages? Any history of chemotherapy or exposure to radiations? Any family history with a chemotherapy? Are you pregnant before? how many times, any abortion or miscarriages? Are you exposed to chemotherapy or radiations? Any family history, the congenital anomalies. The mother has a concern, the baby is green. This means that he passed meconium, which means the baby has a stressful delivery. This means he passed the meconium, baby stool. This means that he had passed the meconium, which is baby stool, and it shows that the baby, that the delivery is a stressful, that the baby isn't stressful. No, the baby had a stressful delivery. The mother has a concern, is it my mistake? This condition is related to multiple factors. Some factors are related to pregnancy, but others are related to the baby or the environment. On the other hand, there are no safe limits for smoking, drinking during pregnancy. So in the future, if you decide to become pregnant, it's important not to smoke, drink alcohol during pregnancy. Smoke, drink alcohol, or recreational during pregnancies. Possible causes: alcohol, smoking, cocaine during delivery, microcephalia, urine, cocaine during pregnancy, torch infection, extreme of the age, especially of the advanced age pregnancy, risk of the age 48 hours, asphyxia and hypoglycemia. Crying baby. Introduction. Hello, my name is Dr. Mirza, and I am a physician on the duty today. I would like to ask a few questions regarding your baby today. So first of all, I would like to ask you, how do you feel right now? It must be hard for you. But would you like to explain more of the condition? When did it started? How did it started? Was it staying all the day and the night? Is he crying more than 3 hours a day, more than 3 days per week, or more than 3 weeks? What initiates or increases the crying? Any chances the baby is hungry? What do you feed him? Any chances he's too hot, too cold? Do you adjust the temperature? Any change he's wet? How often do you change his diaper daily? Is there any skin or diaper rash? Is the pregnancy planned? How about the visits? Are you frequently visiting? Did you do your regular visits? Did you do regular visits during pregnancy? Are you in contact with the sick baby or by chance with a pet? Are you taking any? Did you take any medication during the pregnancy? Any smoking? Okay. Smoking and medication. Any medication planned? Were you screened for hepatitis? Were you screened? Planned? Follow up? Any sick contact? Medications? Screened? Blood group? Screened blood group? How was the pregnancy full term? Was it vaginal or was it a cesarean? What were the complications? Any abnormality? Vaginal? How long? Were the labor difficult labor? Early gush of water? How many hours? Did you feed any help to make it easier? Did your baby cry immediately or not? Do you know what his APGAR score was? Did he need special attention? Did you find any bruises on the baby? When were you told that your baby had a special features? After delivery, did you have cesarean, vaginal, full term, baby cry immediately, APGAR score? When did he left? Did he left with you? Bruises, special features? Fever and discharge. Do you take any medications? Baby full term or not? Vaginal delivery, C-section? Did your baby cry immediately? Bruises? Your baby that any special features? After delivery, do you fever, discharge? Cry immediately. When did it leave? Epcar score. When did it leave? Cry immediately. Epcar score. Bruises. Bruises. Any infection. Any special features? Bruises, bruises, bruises. Swelling, bruises, swelling, bruises, swelling, bruises, swelling. Special features. Did you have any fever or discharge? Did you take any medication? Full term or not? Vaginal, cesarean. Any complications? Full term. Vaginal. How long, prolonged? Did they use any instrument to make it easier? Gush of blood. How many hours? Did your baby cry immediately? Epcar score. How? Epcar score. Did he need any special attention? Leave the hospital. When did he leave the hospital? Any bruises? Any bruises or swelling on the body? Did he have any special features? Facial features, special features. Did you have any fever or discharge? Immunization, did you take any shots? Nutrition, what about weight and the height? Diet, do you feed your baby? Breastfeed. Developmental. Environmental, how do you feel about the baby? What is your relationship with between you and the baby? How is the relationship between your partner and the baby? Are you living alone? Do you have any depression before or now? Do you sport? Where do you live? Do you sport financially, or do you smoke, drink? Or anybody at the home smoke or drink? Any other children in the house? Psychiatry, medical condition, abuse. Crying baby. Okay. Would you like to explain more about the condition? When did it started? Was it staying all the time, or in the day and night? How long did he cry? Is he crying for more than 3 hours, more than 3 days, or more than 3 weeks? What initiates or increase the crying? What initiates or increase the crying? Any chance the baby is hungry? Do you feed him? He is too hot, too cold? Do you adjust the temperature? Any chance that he is wet? How often do you change his diaper daily? Is there any skin or diaper rash? Hungry, feed him. Initiates or increase the crying? 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 Any initiates or increase the crying? Any chance the baby is hungry? How do you feed him? Any chance that there is a hungry, hot, cold? Adjust temperature. Hungry, hot or cold? Wet, rash? What improves or decreases the crying? What initiates or increases the crying? By chance the baby is hungry, how many times do you feed him? Do you change the diaper frequently? By chance, any chance that he's wet? Is there any rash? By chance he's hot or cold? Do you adjust the temperature? Hungry, temperature, wet or rash? 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 What improves or decreases the crying? When he cries, what do you do? What decreases or improves the crying? When he cries, what do you do? Do you try to hug, hold, burp, soothe, play music, give him a walk? Hug, hold, burp, soothe, play music, give him a walk. Hug, hold, burp, soothe, play music, give him a walk. Did you try to rock him, shake him? What happened to him? Did you try to rock him, shake him? What happened? What improves or decreases the cry? When he cries, what do you do? Did you soothe him, walk, hug, hold, play music? Or did you try to rock him or shake him? What happened to him? When he cries, does he pull his legs? Is he passing gases? Is the abdomen distended? Is it related to feeding? How are you coping with this? When he cries, does he pull his legs? Is he passing gases? Is this abdomen distended, or is it related to feeding? How are you coping with this? When he tries, does he pull his legs? Is he passing gases? Is his abdomen or belly distended? Is it related to feeding, or and how are you coping with this? How are you coping with this? How are you coping with this? By chance, what is increasing? Is it type? By chance, is he wet? By chance, is cold or hot? Baby's hungry. Diaper rash, hot, hungry, wet, hot, hungry, hot, wet, and rash. Hungry, hot, wet, and rash. Decrease, hug, rock him, shake him. He cries, pulls his leg, abdomen distended, passes the gassing. It's related to feeding. How are you coping with this? How does this affect your life and your partner life? Are you able to do work? Is he drowsy, floppy? How does this affect your life? Are your and your partner's life? How does this affect your life and partner life? Are you able to go to work? Is he drowsy or floppy? Does he have any fever, any ear discharge, or any ear pulling, any foul urine? Did you notice if your child has fever, cough, wheeze, discharge from the ears, runny nose, foul smelly urine, abdominal distension, or diarrhea? Foul smelly urine, any infection? Review of the symptoms. There will be other symptoms. Review of the symptoms. Any infection. Infantile colic, crying more than 3 hours, more than 3 days per week, and more than 3 weeks. And between the age of the 3 weeks or 3 months without another explanation, reassure. Child neglect, overfeeding, hungry. Scan for the risk factors. Do you feed him breast milk, formula? How about his weight? With whom do you live? Is a relationship? How do you support yourself financially? Do you get enough support? Any other children's? Any repeat visits to the ER, mental retardation, and the alcohol and drugs? Smoke, alcohol, and drugs. Suspicious child CBC, electoral analysis, and the stool analysis. Chronic of eczema. Child complains of cough for more than 6 weeks. Post pneumonia. Father wants to renew antibiotics. Here, we have 2 issues: the productive cough and the fever 6 weeks ago is pneumonia. The intermittent dry cough that presented after, what is the onset, complaint, duration, consistency, color, odor, consistency, and amount. B and phlegm, blood and phlegm. Certain type of day, certain time, day or night. Acute phase or chronic phase. Acute phase seen by the doctor. What diagnosis, treatment? Is it continuous, productive, fever, loss of appetite? Continuous, productive, fever, loss of appetite. Chronic phase, intermittent, dry cough, on and off, no fever, shortness of breath, noisy breathing, wheezes, chest tightness, nausea, vomiting. Does he cough to the extent of vomiting or the loss of consciousness? Did you renew it from the same doctor? Was he examined? Any x-ray were done? How did this affect his life? Daily activities, constitutional symptoms, trigger of asthma, anything that increases symptoms. Cystic fibrosis, any allergy, brief, any other atopic allergy, asthma, skin, recent chest infection, flu symptoms, fever, chills. How do you use puffers? Stored properly, not expired. Do you start new medication, beta blocker, exercise, cold, pollen, dust? Do you smoke? Anybody around you? Do you have pets, people around you? Fabrics, carpet, floor, any change in linen, pillows, blanket, mattress, or curtains? Relationship to any type of food, perfumes? Do you live in a house? Any construction, renovation, exposure to chemicals, any new chemical situations? Diagnosis, counseling, The most likely explanation of that is hyperactive reactive airway disease. It is term used to describe asthma-like symptoms in infants that may use to be confirmed to be asthma where they become old enough to participate in the asthma test, spirometry, and bronchodilators. Asthma-like symptoms. It is term used to describe asthma, but they may be confirmed later. They become old enough to participate in the asthma. Acute. Continuous productive fever, loss of appetite. 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 Intermittent dry cough, on and off, no fever. This is a problem which is usually triggered by infection. It may last up to 10 weeks after infection. It may be self-limiting. However, we need to start treatment with the puffers when the child become older than 6 weeks. If the condition is still persistent for more than 10 weeks, we child for the investigation, spirometry and bronchodilator to confirm the diagnosis of bronchial asthma. If this condition happen in the adults, we used to treat it with the puffers for 4 weeks. If no improvement, we need to investigate for asthma, spirometry, bronchiolitis, and we can methacholine challenge test. Anemia, vomiting. The mother of the 6-week to 3-month-old baby came to the hospital for the child's repeated vomiting. When did it start? How did it start? Sudden or gradual? At that time, did your baby have any fever, flu-like symptoms? It is continuous, or is it continuous? Is it continuous on or off? How about how often, day and night? Content, odor, color, consistency, amount, blood, amalgam. Do you feed him? Is he vomiting the entire amount? Is it watery or curdy? Watery or curdy? Feeding him entire amount. Is the vomiting forcible or projectile? Is it corrector? Corrector timing. After vomiting, do you feel he's still hungry? General conditions after vomiting. General conditions after vomiting, increase or decrease factors. It is related to position while when laying down. Diarrhea. Is he drowsy? Does he cry? Is he high-pitched cry? Did you notice that his sucking is weaker than before? Dehydration, failure to thrive. Constitutional symptoms. Okay, nutrition, pyloric stenosis, diarrhea, bedwetting. Where is bedwetting? Worried about her child weight. Runny nose, rash, delayed speech, seizure, child counseling, ADHD counseling, vaccination counseling, diabetes counseling, bedwetting counseling. When did it onset? Consistency, duration. When did it start? How did it start? Sudden or gradual? Frequency, primary and secondary. Dry, time, soft. Dry period of times. It is continuous, on and off. How often? How often? Day and night. Every day, every night. Stress. Drinking too much fluids before bedtime. How does mom feel about it? Is a baby impacted by it? How did it start? When it started? Gradual, sudden, frequency. How frequent is it? Permanent scan, is it continuous on and off? How often? Day and night, every day, every night, every day, every night, every day, every night. How often? Continuous, often stress, drinking. Too much fluids before bedtime. How does mom feel about it? Child feel about it? Constitution syndrome. Do you notice if your child has fever or skin rash, odd smell or color of urine, pulls penis, and cries while peeing? Do you notice that if your child has fever, skin rash, odd smell or color of urine, pulls a penis, and cries while peeing? Parent attitude, diabetes mellitus, too much water, going pee, feeling tired, losing appetite, history of meningitis, brain infection, head trauma, UTI, any past history of infection, trauma, surgery. Number 3. Trauma or surgery to back, bowel dysfunction, leg weakness, numbness, ear disorders, new sibling, home, school, change school performance, kidney disease, bedwetting, damnitis, and serious counseling. The condition is common. By the age of the 4, 25% have this condition. By less than 75% of the conditions, more common in the boys and girls. It is due to degradation of his development because of the current stresses in his life. Condition is usually less self-limiting, and you need to give the child more time. He will adapt very well to the changes. Try behavior modification for the 3 months. Avoid drinking late before sleep. Try to wake him up to go to the bathroom. Document dry night and use reward system. Avoid drinking before water. Try behavior modification for 3 minutes. And then alarm therapy. Try to wake him up to go to the washroom. Try to wake him up before the washroom. Document dry nights and give him reward system. Alarm therapy, desmopressin 1 hour before bedtime. Be careful to water intake. The only serious condition C is due to the water intoxication. Oxybutynin at that bedtime, if it decreases bladder contraction, therefore it leads to the increased bladder capacity.